let me ask you a hard question. What is the biggest reason families remain poor? The biggest reason businesses struggle. And the biggest reason nations fail to grow. It is not the politics. It is not the corruption. And it is not even lack of money. But it is poor public health. When the health system fails, everything else collapses quietly. Today, I want us to share clearly and honestly the real cost of poor public health on families, communities, and even entire nations. The recent World Health Organization and the World Bank data confirms that billions of people worldwide are pushed deeper into poverty every year because of health costs alone. This is the reality. Before we go deeper, let me ask you, have you or a family member struggled financially because of illness? Type yes or no in the comments. Let's see how this common is, especially in Kenya and in many of the developing countries. What does public health mean really? Public health is not just hospitals and doctors treating sickness. Public health is what stops illness before it starts. It includes clean water and sanitation. It includes safe and nutritious food, vaccinations and disease surveillance, health education and early screening, affordable and accessible basic care, which is universal and can be accessed by everybody. When public health is strong, families will stay healthy, productive, and even financially stable. But when we have a weak public health system, then in many low-income settings, people end up spending up to $17 per person instead of the $60 that is needed. And then illness becomes a poverty trap. One sickness can erase years of progress. So let's go down to the cost of poor public health systems on families. Medical bills destroy savings. In weak public health system, people pay directly from their pockets, and they may not have the reserves. In sub-Saharan Africa, Kenya included, 30 to 46% of all healthcare spending is out of pocket. Families are forced to sell land or livestock, close small businesses, or even pull children out of schools. In Kenya, studies have shown that 70 to 90% of households face catastrophic health spending at different thresholds. And that's why we need a good universal health coverage system that protects the people from spending out of pocket. So one serious illness can wipe out a lifetime of savings. Then what is the other risk of a poor public health system? Lost income and then lost stability. How does this happen? Illness does not only cost money. Yes, you need to pay for the health care, but it steals time and it steals strength. You'll find that the only possible breadwinner, if is sick, then parents will miss work. The caregiver could quit his job. Then if he's a business person, the business might close, and then productivity collapses because it depends on good health to do your work, to go to job. So when the breadwinner is sick, then the entire household suffers, and the suffering can be catastrophic. This is not laziness. This is biology that is being affected by the broken system, and we all suffer from it. Unfortunately, children also pay the highest price in these systems that don't work. Poor public health hits the children the most. You find that families will be affected by malnutrition, and children will be affected, and this will affect their brain development, and this also affects their future performance in their work and even in their opportunities for getting jobs. So they persistently remain poorly, and they poorly remain disadvantaged. Preventable diseases cause loss of school days, and then chronic illnesses follow the children into their adulthoods because of poor nutrition and poor systems. So poor health today creates poorer, sicker adults tomorrow. And this is the reality, and we need to be cognizant of it. So this is how poverty becomes intergeneration. You remain poor because of the system that you have. So let me ask you this very honestly. Which hurts families more? Is it the medical bills? Is it the lost income? Let's think about it. So comment bills or income, and let's see what is our thinking. These poor public health systems, they also affect the nation. So from families to the nations. When you look at poor public health systems, productivity is lost at the national scale level. When millions are sick or caring for the sick, like if you have too many people with diabetes, you have too many with stroke, you have too many people with cardiac failure, then the workforce shrinks. Businesses slow down, nations' income drops because many people are on treatment. They have to have carers, and this affects our overall performance. So preventable diseases like non-communicable diseases drain 1 to 3% of the gross domestic product every year in many African countries. And that is growth lost, not because people don't work, but because they are weak, they are sick, and the systems are not working. The government's aid firefighting. Weak public health forces government to spend more money after damage is done. Money goes to emergency admissions, late-stage treatment, trying to fight cancers at late stages, and this leads to disability in the care system and even to individuals. Long hospitals stays, more people become debilitated, and this breaks the whole system, breaks down. Yet prevention, things like vaccines, universal health coverage, clean water, good education system, screening, all these are far much cheaper, and you'll find that countries will spend 3 to 10 times more treating diseases than preventing them. Poverty becomes permanent. This is the most dangerous effect. Sick parents raise poorer children. Poor children grow into sick adults. Economics stagnates for decades, and the nation's development regresses. Inequality hardens, opportunities shrink, and this is not fit. This is a policy failure. This is the big truth that most people miss, and this is very uncomfortable to many of us. Public health is not a cost. It is one of the highest return investment a nation can make. Evidence has shown that every $1 invested in good nutrition returns about $23 to the economy. Vaccination, clean water, sanitation, universal health coverage delivers 10 to 20 times more returns than treating illnesses. Prevention saves families, governments, and even economies billions of shillings, and strong public health protects families, workers, businesses, and national growth. The big question: should prevention receive more funding than treatment? Type yes or no. What a strong public health system does right. When the public health system is working, fewer people get sick. They prevent diseases. They have the know-how of how to take care of themselves. Families save money. Children stay in school. Workers stay at work and they are productive. Economies grow faster and wealth is created. Health becomes a foundation, not a crisis. So if we don't build our health systems and our public health systems, then our healthcare becomes a nightmare. This is why countries that invest early in prevention, they are able to reduce poverty, they are able to grow faster, they are able to build resilience. So building a strong health system based on universal health coverage is not a luxury. It is a necessity that we cannot ignore. So if you care about your family's future, your children's opportunities, your nation growth, and especially low economic countries, then public health matters. At Health Insights, we focus on prevention, educating people on better nutrition, stress management, better sleep systems, and early lifestyle action, incorporating screening for common health conditions and common cancers, because the cheapest disease to treat is the one that never happens. So join our coaching program and follow the Community Wellness YouTube channel for more public health insights to build our health systems. Let me leave you with this. If you are in charge of public health in Kenya, what would you fix first? Is it clean water? Is it nutrition? Is it screening? Is it universal health coverage? Comments below and let's join this talk. If this has opened your eyes, like, share, and subscribe to the Community Wellness channel for more public health based health education. Strong families build strong nations, and strong public health builds both. See you in the next video, and thank you for watching.